Hello everybody, do you have lazy glutes? Are you suffering from some discomfort or pain around the SI joint area or anywhere in the pelvic girdle, maybe in the hip, maybe in that bony part, the greater trochanter, or maybe that you've noticed in your posture that you're not really activating the glutes. Maybe you started taking Pilates class and the instructor is asking you to use more of that hip extension. So I am here today to talk about your lazy glutes, and I want to talk about the things that you might not be doing. So whether you are trying to actively strengthen them, whether you're looking to have that bodacious booty, no judgment, whatever it is that you're looking for, I want to talk a little bit about why you might not be achieving activation and contraction of those gluteal muscles in your exercises and things that you should be doing and can be doing every day. So the first thing that I want you to have a look at is your balance. So you may not be activating that part of your hip musculature as you're balancing on one leg. So that means as you're through your gait, as you're walking, because you have a moment of balancing on that leg, as you are going up the stairs, you may not be using that glute max, so the back of your hip, to activate as you're going up the stairs. So in your daily life, over and over and over again, you may not be using those muscles. And there's a few simple ways that we can try to do that better. So the first thing I want you to do is have a look at that for starters. So let me adjust the camera here so that you can have a look at me and see what I mean by that. So when you look at your balance, and so apologize, my head is out of the frame, but you do not need to see that right now. When you look at balance, if you balance and you notice a couple of things, you notice that you're maybe over on the side, or you notice your hip hiked, all of that means that you're not using this musculature to keep you stable through this area. That may or may not play out into your daily life. You'll notice on the other side, you may have more, you may have less, that hip lean, that bending through here. All of those things can be responsible for a little bit of discomfort through this area. Often people will get a little bit of irritation through the tendons here if they're not actually stabilizing with the glutes. So the first thing is trying to find that. Now this also might be because of your posture. You might be forward, and I know this looks like an exaggeration, but often I'll find that my clients are here when I'm looking at their posture. So if you look at that, we have a lot of pressure through the knees, but not much going on through here. So that's the first thing. Are you stabilizing through this area as you're walking, as you're going up the steps, as you're doing your exercise, as you're doing your training? And if you're not, then we need to help you find them. So one of the ways that you can do that is through the contact with your foot and having some pressure through your heels, finding that alignment. And part of that is getting a little uncomfortable, because when I ask you to kind of come back, you might feel like these kind of turn on and are active a little bit, but you might also feel really awkward. So that's why I like to work with you and to guide you so that you're better able to find that and know what is working for you. And so that's all part of the process of neuroplasticity and finding that neuro activation, finding that sense of where you are in space. Now, the second thing you might not be doing is using your glutes for forward bending. So if this looks familiar to you, and that's just your daily life, or if you're squatting, then what am I not doing here to a certain degree? I'm not really using my glutes to power through those movements. So if I'm just bending forward and coming back, it's the extensors of my back that are doing most of the work. If I am squatting like this, and actually in this one, I'm doing a pretty good job of kind of hinging back, but say I'm squatting like this and I'm coming forward, there's a lot of quad activation here, and there's quite a lot of stabilization through the lower erectors. And sometimes these are the people that I'll find are getting a lot of pain here and maybe some anterior knee pain. And then often when we're working through this exercise, there isn't really even that relationship of where those glutes are in space. So if I say, well, can you feel some activation, some burn there? The answer will often be not so much, not necessarily. And does that mean that you're not necessarily working those glutes in that position? No. It actually might just mean that it's going to take you a minute to really feel it. So let's actually move straight into what you can do and a couple of exercises I might give you. Now I might start off by saying, okay, in daily life, you're doing quite a lot of having to bend up and down, sitting in a chair. What I want you to do is find your core, find your alignment so you're not hinged like this, squeeze through your bum and bend back And if it's someone who's having some pain in these transitional movements, then this becomes really important. So I may focus on this. Now for you, if you can immediately find those glutes awesome, if you can, I might actually just get you to pulse there. I might have a wall behind you because it might be tough for you to not do that. So we might even find that decoupling this sort of co-contraction and really finding the glutes extension moment is difficult, and I might have to work with you a little bit there. The other thing that I'll often do, if that's really tough, is I'll get you to forward bend over a surface. So that could be a counter. I'm going to do this kind of balancing right now. That could be a chair, and I'll get you to kind of lengthen through your spine so that now we've taken the spine out of the equation so that you're not powering your hip extension moment through your back. And I'll get you, so just pretend I'm not balancing here and I've got something here. I might get you to kind of hold that hip in this extension moment and squeeze through the bum. And that might be where you've got it and you've found, okay, now I can isolate that contraction. Now for you, if you're actually able to squeeze your bum and get that isometric contraction, which means you're not actually moving the bum, but you're squeezing it, then that's awesome. And that can be something that you start to do just to reconnect. Repetition is everything when it comes to neuromotor patterning, and this is a neuromotor issue, typically. It might also be an inhibition issue. So if you have on one side quite a bit of pain, then know that it's just gonna take a little longer for you to activate all of those muscles. And right now we're talking about glute max and glute med, and we're not gonna get into the anatomy too much, but it really is that hip extension and also hip stabilization on the one leg that we're talking about. The last exercise I'm going to show you that can wake up your lazy glutes is also something that's not for everyone, and particularly for you if you have SI pain, SI joint pain, which is this joint back here, feeling achy, or lower back pain. You're going to have to adjust this accordingly. So you might find that this feels okay and that you can squeeze your bum and lift up one of your legs. And I like to give you isometric holds. So that means holding up for, let's say, 5 to 10 seconds. And I might have you all the way down, but for the sake of this microphone, I'm coming into a bit of cobra, so I do have a little bit of back extension. I often will cue people to draw their core in so that it's not all, in the back, especially if you have back pain. And then holding that, I can feel that quite nicely through my glutes. And now the reason why this can be a great way to wake up your glutes is that you're quite stable in this position. So when everything else is not moving, then you can find that connection. And what that muscle is doing is extending the hip. Some people don't find that the glutes can activate here or that there's pain, and that's okay. And that's when I'll get them to do that forward bend, and it can be a little more successful. People are feeling lower back pain in this position, then having a pillow bias that flexion through the lumbar spine, meaning take that curve out of it, and then finding it here can also be really successful. So I always like to frame this again as this kind of brilliant moment of change in the body through neuroplasticity, honestly, so that people just don't feel ridiculously bored, because otherwise it's not a super powerful moment of muscle hypertrophy. What it is connection so that you can access over and over again. And then eventually, if you're working with weight, you're not causing back pain, you are actually causing that hypertrophy of the muscle and creating a little bit more of that tone and that strength that you're looking for. But we first need to be activating them, because we know that muscles co-contract, and some muscles can be working harder than others through those movements. And so if that for you is your lower back or your quads working instead of your glutes, then we need to problem solve. And doing some of these exercises in this way will help you get there. I work out of my clinic, North Vancouver, Blue Ridge Physio. I'm a physiotherapist. So if you're in the Lower Mainland, please connect with me and you can book an appointment with me in person. I will also be offering some courses online and some online appointments, so you can connect with me and see if that's something you're interested in. But otherwise, working with your physiotherapist is really important. An individualized approach absolutely is what you need to find that connection, because there might be various reasons why it is not there immediately. Thanks so much.